My little sister, she got really bad information on TikTok that babies don't move much during labor. She goes into early labor and her baby wasn't moving as much as he normally did. And it was really, really hard to convince her that she needed to go in and be seen because she felt, one, embarrassed, and two, it just had this pre-existing misconception that the babies don't move much. It's one of the worst deliveries I've ever seen. It was really traumatic. But after that, I remember thinking like, this cannot keep happening. If it's as simple as me just telling people like, no, babies should always move. Either you should always be expecting a normal pattern. Just simple things, conversations I'm having with my patients day in and day out. So I decided I just wanted to reach as many people as possible, educate them on facts. I don't want them to feel judged. I want them to feel embarrassed like she was feeling. I want them to feel stupid that they didn't know that. I just wanted them to have the facts and then trust them to make decisions for their bodies and their own plans of care.
Welcome to the Keeping Your Power Real Talk on Resilience podcast. I'm your host, Tracidoula. I'm a family and birth advocate, a mentor, and your personal encourager. I wanted to create the space for individuals, families, and professionals who are done with just surviving and want to rise. Because when everything feels like it's falling apart, the one thing the world can't take from you is your power. And that's where resilience begins. It's not just riding the waves or surviving the storms. It's about how to overcome the challenges. So whether you're in the thick of it or reflecting on where you've been, pull up a chair and let's navigate the hard conversations and the beautiful stories that together we can be honest and use empathy and have a desire to grow, all while, of course, keeping your power in the process. Hey everyone, welcome back to Keeping Your Power Real Talk on Resilience. I'm your host, Tracidoula, and today I'm sitting down with one of my favorite labor and delivery nurses, Sarah. And I have a special place in my heart for labor and delivery nurses, or nurses in general, but I heard that y'all are not a profession anymore, so I guess I'm just going to have to change my mind on that. We are petitioning for loan forgiveness for all nurses who are involved in that ridiculous decision. I feel like I've known you forever, and just following you and just some of your personal story, you've had a lot go on here lately. And I'd love to dive into that because we just talk about resilience and hopefully our stories can overflow onto somebody else and encourage them. And we can come alongside, each other and just support each other. My heart for labor and delivery nurses, I've just been a doula for forever. And so I've just doulaed the room is what I call it. And I really have doulaed a lot of labor and delivery nurses too. They're like, I don't know what this person needs or wants. So tell me a little bit about how long you've been doing what you're doing, where you are.
Yeah. So I've been a nurse for 16 years and I've spent most of my career, like well over a decade, only doing high risk labor and postpartum. The first 5 years of my career, I did nothing. I had nothing to do with birth. I didn't have kids, anything. I always thought it was really, really interesting and fascinating. And, the day I got on the labor delivery unit, like when I switched and transferred to that specialty, like this has been the fastest, 11 years of my life. Like I've told people like my first 3 years of that career, I was just like on a constant high. Like I couldn't have a bad day. It didn't matter how crazy it was. I just truly felt passionate about it. But as you know, especially in the United States, there's a lot of financial, racial disparities. There's the way our system is set up in women's health. There's not a lot of educating happening. There's not a lot of fostering a chance to educate during your pregnancy. So I'd have patients coming in and they would just be maybe, I don't want to say clueless, but they would be moving forward with procedures or treatments or interventions, without even a basic knowledge on the risks, the benefits, the alternatives. And it's not that I believe interventions are inherently bad. I just really strongly believe in informed consent. What ended up happening was one of my sisters, my little sister, she delivered at the hospital where I work and everything was fine, but she got really bad information on TikTok that babies don't move much during labor. And, they don't have a lot of space there. It's normal for them not to move much. And she lives down the road from me. She goes into early labor and she her baby wasn't moving as much as he normally did. And so it was really, really hard to convince her that she needed to go in and be seen, because she felt, one, embarrassed that what if everything was fine. And two, it just had this pre-existing misconception that the babies don't move much. And it's not that she didn't believe me. It's just like to like in the moment, real time, convince somebody that like this was misinformation, and especially when they're embarrassed about going in, and the bills we have here, if you go into triage, it's hundreds, thousands of dollars out of pocket. She went in, and it was a crash section. It was one of the worst deliveries I've ever seen. He ended up being on a ventilator he was 40 weeks for a week and a half. And it was really traumatic. He's great now. He'll be turning 4 soon. But after that, I remember thinking like, this cannot keep happening. If it's as simple as me just telling people like, no, babies should always move. Either you should always be expecting a normal pattern, just simple things, conversations I'm having with my patients day in and day out. And so I decided like, I just wanted to reach as many people as possible, educate them on facts. I don't want them to feel judged. I want them to feel embarrassed like she was feeling. I want them to feel stupid that they didn't know that. I just wanted them to have the facts, and then trust them to make decisions for their bodies and their own plans of care. And so the best way to do that was, I never had a TikTok. I'd never even seen a TikTok, but I knew everybody that was having babies was on TikTok. So like I opened up my account, and like literally day one, first video was just like reasons to go to triage. And, I had tunnel vision, like I like super laser focused, like what my purpose was and what the account existed for. And
labor junkie RN was born.
So it has begun, the origin story. So
and I do feel like that we're like kindred spirits in that, because that's kind of how my, childbirth education kind of came about too, or just the passion to educate because of the gaps that I was seeing. But then social media makes that, the benefit of reaching more people with the correct information, because even in our little silos, we can kind of educate just a little bit in the fan base that we have just locally. But that's what I'm thankful for. I have this love-hate relationship with a lot of social media. But the counting the kicks and the movements and that seems to be a very big, devastating, can be fatal misinformation that and of course we have a 15 to 20 year evidence practice gap, but I feel like, there's that gap of good information that takes a long time for us to get out there too. But when there's some misinformation or disinformation, it takes even longer, I feel like, to erase, because there is so much, the parents and stuff that I'm hearing is, I just don't want to be seen as high maintenance, or, I have people roll their eyes at me when I get there, or, and I'm like, well, first of all, keep your power in the process. If you, when in doubt, get checked out. If you feel like something is not right, then something's not right.
Exactly.
And, don't listen to me. Don't listen to Sarah. Don't listen to people on the internet. Make sure, make sure that you're getting really, solid, good information, and really intuition is everything. If you, if you're feeling like something's off, then something's off. Nobody needs to, don't look through TikTok and see, is something off, because you might scroll by somebody that says, yeah, you're good. And you're just not good. So, I hate that that's what drove you to the social media streets, but I'm glad it did, because I got to meet you. And what kind of like propelled me into wanting to know more about you, not just your videos and not just, us both educating, but I saw how you educated, and I saw your heart, and I saw, autonomy and agency and informed consent, or educating people so that they have all of the bigger picture that we really don't see a whole lot of. So, and of course, I don't see it a whole lot of, because I'm a doula, and we're just on the lookout for those, red flags of omission and coercion and those kind of things. And I think the balance too is educating without throwing everybody under a bus.
Yeah.
Right. And, saying, okay, here are things that can happen. These are the things to look out for. And then just like you said, living in a country that is, driven a lot on business and a lot on, the administrative risk assessment part. And sometimes it's just the standards of practice that are being, delivered.
Yeah.
And I just feel like that passion to get all of that out is both of our goals. And I saw your birth video, or one of your birth videos, and I don't know if it was your second or your third, but I'm like,
it may have been my third. I think it was my third.
Yeah, I'm like, oh, she's out of the bed, and she's a labor and delivery nurse
on a high risk unit.
On a high risk unit.
It can be done.
Yeah, because I knew that you did a lot of like high risk birth. I mean, a lot of high risk labor and birth. And tell me, just to kind of get the average person listening to this, what makes, or what do you feel like you see the most that makes people high risk?
Yeah, probably what I see the most of is, we kind of take everything in my region, my state that is the other hospitals just cannot like accommodate or don't have the resources. A lot of preeclampsia. We see a lot of I don't like the word cervical insufficiency, but that's what they coin it. Where like the cervix is opening, maybe you're only 14 or 15 weeks. A lot of like the water broke at 25 weeks, and we're going to see what we can do. We see a lot of like just anatomical structural things, stuff with the baby that may be anatomical structural heart conditions, or, gastroschisis. We have a really high level NICU, at my hospital as well. So it's not just high risk for the mother. Like sometimes mom's doing great. She's thriving during her pregnancy. But when the baby once we cut the cord and baby is on their own, we need to have that NICU present to help support the baby. So, we see placenta accreta, we see placenta covering the cerveza previa. There's some days where I'm like, I couldn't have even dreamed up this situation. Cardiac issues where, the mom needs to be monitored a certain way, or we have a very specific plan of care to like keep her heart safe during the birth. So I see it like you name it. We don't turn anything away. So we take it. Yeah.
Are there some things that a provider has deemed high risk that you're like, I
would say the one good thing about us literally taking everything is that because they've seen like the most extreme of the spectrum, I think they're pretty good about not using the term high risk, like, flippantly. So I'm, where I'm working, somebody who's like 38, 39, we wouldn't call them high risk just because they're advanced maternal age or whatever. But I found out online that some people are told they're high risk just because they're over 35. So we maybe we would change some things in their care to follow ACOG's recommendation, but we wouldn't say they have to see maternal fetal medicine just because they're over 35. So I do feel like they use a little discretion before throwing that term at somebody. But the one thing I also find that goes along with that is they're great about not coining everybody high risk just because. But we also have midwifery practice. So we literally take everything. We take everybody who wants to have a baby with us. They're welcome to have a baby with us. So when we introduce midwifery practice, then it was what comes with that is they're really, really used to seeing things need help and assistance or trying to prevent or anticipate complications. So then when you have low risk, like minimal intervention, that can be hard for them just to sit on their hands and, well, what is our purpose? What are we doing then? She's just here. We're like, literally, that's it. You're just here. You're a safety net. We hope we don't need you, and just sit on your hands. That can be tricky when, we're so used to being needed, Yeah. So I feel like maybe I see that more where it's hard to be patient or sit on our hands and not intervene when it's not indicated or wanted. We're working on that.
I mean, it's all a work in progress, right? Yeah. all a work in progress. And like I said, I have doulaed many labor and delivery nurses and providers,
Yes, exactly.
It's going to be fine. Tracy, but it's okay. You're you're here for just in case. And,
Yes.
you know, you
Yeah.
don't have to do something just because you're bored. I feel like for parents or for, you know, pregnant moms that have been labeled that high risk, and I see a lot of this in my comment sections on TikTok, on Tracidoula, it's, you know, well, my doctor said I was high risk, you know, because of my age or because I'm IVF or because and it's more of a blanket statement. So I feel like, you know, we just need to be very proactive in the why. You know, well, what is in your head that makes you feel like I'm high risk, and get like the specific reason why, not just IVF, but IVF connected to a specific individual reason, or, you know, well, because I had high blood pressure before. Okay. Specific reason, you know, we're going to like watch your placenta and, you know, all the things. So, you know, that's really good that you work in a space that is like, okay, we've seen this spectrum.
Yeah.
We're not going to go crazy.
Yeah.
Or absolutely, you know, because, you know, being a labor and delivery nurse on a, you know, high risk floor, you might be like identified as high risk, but not be on a high risk floor. So since you're on a high risk floor, you are seeing the very, you know, kind of nuanced things that potentially have a higher risk, you know, placenta previa and, you know, all the clotting disorders and
that too. All the pre-existing conditions that can complicate or be complicated during pregnancy, for sure.
Yeah. So, and I don't know why we're seeing more preeclampsia. And I think my theory, which is going to be really not, please, this is not.
I mean, sometimes theories are a great jumping point, and we're onto something. So
yeah. Well, I mean, you know, just kind of being an out of the box thinker, since the pandemic, I feel like the health has kind of turned for, you know, people that are just in childbearing years because of the shock of what all happened during the pandemic, the isolation, the health scares, the nervous system, the everything that goes along with that. And then I think that has carried over into, you know, some just health issues that start out at the very beginning, and that placenta is just not, you know, not doing the job. And then of course, all the sicknesses that I feel like are out there that we don't talk about, the flus and the variations of the flus. And then of course the COVID's not gone. And I mean, it's still there.
I just had it 2 months ago. It is not gone.
And that's just my theory, because I didn't see 5 years ago. I can't believe it's been 5 years. But 5 years ago, I wasn't hearing it or seeing it with my students, my clients, or I wasn't like really seeing it as much. And of course, I'm just a little percentage, but I wasn't seeing it as much as I am now after the pandemic.
Yeah, I don't think that's a crazy theory, honestly. I think like what we do know is we have a lot of studies showing us that like stressful scenarios during your pregnancy can have an impact on you and your baby and your pregnancy. Not so fearmonger people listening that like, if I'm stressed, I'm going to have a bad outcome, right. But more like acknowledging like what you have to go through to exist in like a constantly stressful state. So I think the pandemic, I mean, yeah, I've been doing this 16 years, and the pandemic was the worst couple of years of my whole career. I was pregnant during the pandemic. It was very, very, very scary and stressful. And I think, like, it's okay to acknowledge that. And then 5 years in one way feels like a really, really long time. But at the same time, like, it wasn't that long ago. Like, we've only been out and feeling more comfortable. And, you know, I think also just like throwing in, like, when you are in a pandemic and everybody's quarantined and isolated, even just physically, you're not out and you're not in the gym and you're not moving, you're not taking walks, you're not doing these things, you're not going to the grocery store. Mm-hmm. Like little like moments of mobility have to be paused. And that happened for years. And so like you're breaking old habits, you're breaking old thought processes, you're like, we're pretty fresh out of it when you really think about it. And so I think like the process of like feeling comfortable getting pregnant again, and people probably lost their jobs and their businesses, their companies during it. And now they have to like rebuild all that before they can think of like, there's a ton of stress there. And I don't think it's wild to consider that maybe this is having an impact on our health outcomes during pregnancy. Like, I don't think that's crazy at all. Mm-hmm. I think that's really following logic, honestly.
Mm-hmm. Mm-hmm. Well, and it's what I'm saying just in my fan base and in my little community on TikTok, Instagram, and Facebook, that pregnancy doesn't seem to be a joyful thing for a lot of people right now. And I'm just supporting a lot emotionally when it comes to, and you're right, like the job situation, just economically, people are not doing well. And I'm Generation X, and my millennial kids, are doing well, but not as well as I did at their age, and then, you have the Generation Xers that are just, my youngest daughter still lives with me and she's 24. So, and that's fine. That's fine. But society has these pressures that I think, especially on pregnant moms, that are like, you have to be striving to do a certain thing. You have to be this weight. You have to be this age. You have to have this blood pressure. You have to, because I am hearing too high risk, high BMI, so it's like, oh, preeclampsia. Well, where was the stress coming from? Was it coming from your provider? Was it coming from this unreasonable expectation that birth culture has put on people? Yeah. What like, and I'm going to say possessed, because that's not really the word I'm looking for, but what was in your belief system that caused you to really want kind of an out of the box birth, being on a high risk floor?
So people have asked me that in like other podcasts, or like, especially when they see my birth videos, and first they think I'm at a birth center or something. The thing that's like hard to explain is, even when I have high risk patients, if they're safe and if it's like possible, I'm also going to get them out of the bed and offer a birthing ball and do peanut balls and move them. And I'm going to have conversations about how we manage an augmentation or induction, if that's where we're at. I'm going to try to do skin to skin immediately for as long as humanly possible. I'm going to try to do their measurements. And if they want injections while we're skin to skin, I'm going to try to breastfeed. We're breastfeeding in the OR. I've gotten permission while they were under general anesthesia. Like, hey, if we go under general, can I hand express and do skin to skin and take pictures for you? I'll do anything humanly possible to try to keep them involved and keep it collaborative and normalize it of like a very abnormal, high risk, scary position for people. So I think I'm like, okay, if we were not high risk, what were things that would maybe make them feel more in charge? What are ways I can give back autonomy? And like, where can I maintain that in our situation? Cause I've said so many times, like, I hate with all my being when people say all that matters is healthy mom, healthy baby. I'm like, that's the lowest bar. Like, the bar is in hell. I can count on one hand the times that I work where like literally it's so critical that I'm just like, I just want to get out alive. Right. Like it certainly happens, right? If you talk to birth trauma mama, that certainly can happen, but it is not most of the time. So getting from point A to point B, I need to really make sure they're in the driver's seat and we collaborate and they feel autonomous. And like, anytime I can give them like a choice, I want to honor their choice. So for me, when it was time to have a baby myself, it didn't feel that out of the box, because I was when I had my midwifery patients, I was absolutely practicing that. And when I had people with preeclampsia on magnesium and they were diabetic on insulin drips and all the things, I still was practicing that any way I possibly could. So for me, it felt very intuitive and natural to be up and out of the bed and to be in charge and to be in charge of my care and to direct where my birth was going. As far as like specific choices I made, like when I had my 3 kids, I didn't like utilize an epidural and I didn't get induced. It's not because I think like they're bad or I've seen scary things going on behind the scenes per se. It was more like what I was looking for. It was more likely to achieve, like I wanted minimal intervention. I kind of wanted things to play out in their own time. And so that was more likely to happen if I made those decisions. It wasn't because I thought the other decisions were bad. And I had backup plans. Like if I was suffering or miserable or something came up, and I wasn't going to not get an epidural or I wasn't going to not be induced if it's medically indicated. Like, so I think,
I don't know how many times I tell people laboring can turn to suffering, people.
There's coping and suffering. Yes. And so I'm like, if I'm that's what I tell people too. And I ended up not getting the epidurals in the end. It was just because like I was coping. If I got to a point where I'm like, I am not coping, I'm scared and I'm suffering and this is awful, I would have gotten it. So I was coping. And I was fortunate that like things fell very like organically, like the domino pieces were one after the other. I was progressing well. If I wasn't progressing well, or I did have preeclampsia, or my baby wasn't tolerating it, I maybe would have made different decisions, but I was like, the stars aligned. So that's how it played out that way. But yeah, like it didn't feel super out of the box for me in my practice because I'm going to be encouraging autonomy and informed consent and getting out of the bed and my patients being involved in their care, no matter what situation they're in. So
this is great because this, pointing out that philosophy on your birth team matters. And yeah, you might not be able to pick your labor and delivery nurse, and we can talk about if you don't jive with them later. Like, yes, our goal is to, uphold somebody's agency and autonomy. And of course you can ask for things if things are not going well, but it really matters what your birth team thinks. And this is where, in my keeping your power for professionals, comes in. I drive home the fact we've got to do bias checks. We've got to be unbiased and non-judgmental when we're taking care of people because it can overflow onto their birth. And, say like somebody gets a labor and delivery nurse that's like, oh, you're high risk, you have to be in the bed the entire time, can absolutely shift the projection of their birth. Like 100%, whether their baby rotates down well, whether their pelvis opens well, whether they get an epidural or not, because maybe they've been told to stay in the bed because they need to be on the monitors or all the different things. And then the providers that they use, same thing, philosophy wise. So I'm so super your community is lucky, Sarah, to have you in a high risk labor and delivery situation that still is going to provide the knowledge and the tips and the tricks to do all the things so that they don't, get in a snag or get in a place. And I think that has probably changed the trajectory of a lot of people's labors, and they need to write you and say thank you.
That's so sweet. And the other reason I don't love the healthy mom, healthy baby thing is I'm like, you can have two people who had the identical birth outcomes and feel really differently about it. And it will impact like their postpartum recovery or their bonding or their choices on even having other babies down the line. And so sometimes we do end up having a C-section if she didn't want one, or sometimes we do end up being induced if we didn't want one, or we did get an epidural. Maybe she initially wanted not to. But the difference between that being like traumatic or that being like empowering is like, I want her to look back and feel like peaceful with how we got there. Like I've had C-sections where like, maybe that wasn't our plan A, but it wasn't traumatic because she was like, we tried everything. Yeah. My nurse kept me. I was in charge of everything. I made all these choices. She moved me like freaking, like I was in Pilates all day long. Like my team was super, like they really encouraged me and supported me. And like, here we are. And she can look back and I don't want them to be like, well, what if, right. I don't want that. I want them to be like, girl, like I did it all. Yeah. Here we are. And I'm happy. I feel good. So
I tell my clients that like when they're interviewing me and they're like, hey, I want a low intervention, no pain medication, vaginal birth. And I said, well, I mean, we can prepare for that, but my goal is for you to be psychologically whole coming out the other side.
Yeah, that's it's such a great way to look at it because it's like, again, been doing this a really long time. I'll get you there safe wise, right? Like I got you, your safety, your medical stability. I got all that. Mentally, like when I clock out and go home, I have nothing to do with how your recovery is. So like, I want to set you up as best as possible. So yeah, like psychologically whole. I love that. That's such a good way to look at it because that has a huge impact on your entire life and your immediate recovery and your baby,
Yes. Yeah. That 1 in 3 study that says that the 1 in 3 people have felt like they were traumatized in birth. And it was because of the breakdown of communication. That really hit me when I was, really diving deep into advocacy and why I was advocating as hard as I was and training doulas in advocacy because, I'm like, I can emotionally support, people. I'm just a natural encourager, personal encourager. And, I can do that. I can physically support you through birth. I've taken the trainings. I've done the things. I'm a spinning baby parent educator. We can rotate that baby. We can do the things, but, the breakdown was were, people's belief systems being honored, even in the midst of maybe the navigation going off the rails a little bit, hey, it's not about a vaginal birth anymore. This is about, this versus this, and playing the games of would you rather, and making sure that people were allowed to critically think through the information.
Yeah.
And being, and we talk about empowering people to give birth. And I'm like, oh, that's still so triggering to me, because I'm not empowering you. I'm just giving you this space to empower yourself and, and to find your own power in this process. And I still think that, you have the perfect position. If somebody is in, where you are and is in high risk, I'm like, okay, just ask for Sarah. Just tell Sarah she has to work that day, to be taken care of. Because I get a lot of people that are very fearful. I have this diagnosis. Oh no, I'm grieving something that I didn't know was going to happen. And I've always wanted a, natural, quoting that, because that means different things to different people. Or I just always wanted a vaginal birth. I always didn't really want the epidural, but I've always had to have it for some reason, and still coming up on the floor and having somebody go, I hear you. And this is your situation, but I hear you. And we're going to do the things. We're going to, keep you healthy and your baby healthy, but we're still going to do the things that I'm telling you, that is huge value and a treasure that I know specifically people in my town do not. That's going to be few and far between. Here.
Oh.
Yeah.
Well, I'm just hoping it I wanted to make an impact with my patients clearly, but you wanted to make a really resounding impact with our the healthcare community, so that there's more and more, I want that to be the norm, so that when you walk in and somebody isn't honoring beliefs, or they aren't giving people choices, or they're saying, I'm going to check your cervix, instead of, do you mind if I check your cervix? I want that to sound gross to everybody. I want that to sound like alarm bells. I'm wanting to change the tide. So change is hard. Growing pains are hard. I think it's hard to break old bad habits, but we can do it. So I'm just we're, you and me, everybody out there fighting the big fight. So
yes, we're in this together. What is the hardest thing that you've had to advocate for, or situation or a story that you were really are you kidding me?
It's hard.
Or maybe the same provider, or maybe the same thing that comes up over and over again.
I think the hardest thing is culture, breaking unit culture. Because if I'm with a team, because there are people on our team, MFMs, maternal fetal medicine, high risk people, interns, residents. And if they're in camp A, where they are they're patient, they're okay at checking in with our families and letting them be in the driver's seat. They're okay with hey, at this point, we might recommend X, Y, and Z. Do you want to take a beat to think about that? If we're in camp A, we are vibing, and we're we found our groove, and it's going really great. And that's the culture, and that's lovely. But then you have people in a different culture, and it's a unit culture. I mean, not a religious culture or something. You have other people that you work with, they're in camp B, where it's authoritarian and traditional. And we have rock brain, where we're just stuck thinking it's got to be this way. Or they just really struggle to see why people may make the choices that they make, or what you don't even need to see. You don't need to understand, but you need to respect that they have that autonomy. That can be a real struggle. Even when it comes down to little things because I just did a spinning babies workshop. I love spinning babies, been using it for years. And so if I have people in group A who really believe in that, and who are yeah, the physiology, the birthing process, and clicking that baby in the right position, I can do these crazy, wild, silly positions with somebody on magnesium and an epidural and a drip and this and that. And they'll be go do your thing, Sarah. If I have people in the group B culture who are no,
Sarah, no, we can't do that.
Don't do that. No, I literally will have to make sure they're not around, and have somebody at the door to so that I can do these things that I know are evidence-based.
Right.
But I have maybe it may not just be, maybe it's not even a provider. It might be a nurse. The nurse that's that day, and they're it's got to be this way. And so that I feel is my biggest struggle is just letting having fluidity, being open-minded, and like rolling with the evidence and not like having rock brain and stuck on one belief system and then cherry picking little studies that may support that to just be, what do they even call it? That it's, I forget what it's even called, but it's like you're creating your own little version of reality and staying there. You're not just letting reality show itself to you. So that's the trickiest part is I'm like, I know this is evidence-based. I know this is the right thing to do. I know this is going to minimize trauma. And I feel like I have to like find a sneaky way to do it because this culture here is not, this thought process here is a roadblock for me. So
yeah. I mean, and in the doula world, even more because we're just doulas, you know. And if you feel like your profession was taken away, we've never been there.
I couldn't even imagine how that would be. Like,
So the, you know, before our name even got out there that, you know, hey, doulas are going to, you know, bridge the gap to maternity care. And I'm like, y'all don't know. That's first of all, no, we might be a part of the equation, but we're definitely not the answer. You know, when I first started in 1999, it wasn't even 2000. It's crazy. We're partying like it's 1999. And a nurse is like, you know, how do you get to do what you do? Because I think a lot of labor and delivery nurses that I've talked to are like, I went into this profession to do what you're doing.
Exactly.
You know? And I'm like, I'm really sorry that you are so busy charting, first of all, that takes most of your life away from you. And you can't come and support and emotionally get to know your client, your patients the way that you would really love to do that. You know, but I've done this and I've done this. And, you know, of course, we're not regulated. That's kind of changing with Medicaid and insurances, which our doulas are definitely involved in those things because I'm all like, if there's regulation, there's control. So that independent part of me is like, I get it. You know, there's such a spectrum, but it was a trail to blaze. And it was very, what is your job? We're not sure what your job is. Are you overstepping? What are you doing? Why are you here? And so, you know, trying to build a lot of trust through that has been good, but it's the same. It's bringing in something new that would definitely be category of we don't know what this is. Of course, I live in the South, so it's very traditional medicine. Do what your doctor says always. Yeah. And that was their attitude. Like, I'm barely even listening to my patients, much less talk to you about what position do you want her to birth in, or, you know, these things. So just, you know, keep trucking. It's I'm back today. Yep. We're going to do the same thing. And, you know, I think over time it was, okay, Tracy, I am seeing the benefits of what you're doing.
Exactly. You've just got to be like, trust the process. Even if they don't trust the process, eventually they're going to start to see the outcomes. And then, and then they start like, no, Sarah knows her positions. Like, since I act as a doula with my patients and the charting can wait, like, unless it's important charting, it's going to go in there. But like, great. That I'm like, my job is to be there for my patient. And if like, I'll find a time to chart. I'm great at time management. Like, I will be the doula nurse to this person unless they have their own doula, then I'm going to respect the doula's position. But like, and then as people start to see like, wow, that person did not get sectioned because Sarah went in there and did her magic. They'll say that like she does her hui or whatever, or they'll do your juju and they'll be like, go and just do your juju in there. And like,
I had my OB mentor before he retired right after the pandemic. I would love to get patients that were seeing him before they got to me. A lot of my clients would get to me first and then they would pick their provider. But back before that, I would get, and I'm like, yes, I loved him so much. And he kind of like would answer my questions and he would, he'd be like, look, you've got 2 hours.
Yeah. Yes. We're calling it. And then you're like, all right, see what I can do.
Okay, pull it all out. And then
challenge accepted.
Like, I don't know what you did, but good for you.
And then the more they see that, then it kind of like, it softens the sharp edges a bit. And we start to be like, okay, this isn't like, this can be collaborative and we are really helping each other. And this isn't about, because I know, especially if you do high risk stuff where they were really, really sick sometimes. And so the idea of being like, sometimes people do, like, especially in like medical stability hierarchy and things, you're just like, okay, your little birth plan, like, I'm sorry, I'm just trying to make sure her blood pressure isn't 200 over 100. Like, your little birth plan is at the bottom of the totem pole. And you're like, no, 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 no. Like,
Right.
not going to treat it that way. We can intertwine and like, but yeah, I know that that's how people kind of look at it, is like you and your little crunchy stuff over there, and they have to see it and working. And then like, you just have to see it sometimes. It doesn't matter if I throw all the studies in your face. Like, I believe that. I'm sure they see you and they see your outcomes, and then they start to be like, oh, Tracy's here. Yay. Like,
well, and I don't even argue evidence. Like, it doesn't even matter to me. You're like, I don't, that's not my, like, I'm not trying to convince you of something that you might not believe in. Like, I'm not trying to convince you. So like, when I was starting to train other doulas and other people just on advocacy in general, I'm like, look, it's all about perspective. Who are you dealing with? Who is on your team? And then kind of, you all navigating, because when I was, talking to doctors about, like, I understand why you don't want her to birth on the birthing stool. You've never done that before, and
you're legally responsible if something happens.
Right. Like,
because I know there's that too, like liability, and
I mean,
so,
it's all about perspective and where somebody's coming from. And so, and then talking to everyone in the room at the same time, I would get really weird looks, like, hey, my client, everybody is by their name. And I would call the doctors by their names and the nurses by their names. And we were all on a first name basis by the middle of that birth. And, recognizing that not everybody was comfortable with everything, but the person's belief system that mattered was the one that was having the baby.
Exactly. Yes.
And, so, and then it was just like, oh, here comes Tracy. And now I'm going to have a conversation. It wasn't just like, hey, go set her up for delivery. It was more like, oh, okay, well, what are we doing? What are we doing today? And then, I had a lot of on-call doctors come in, and it wasn't their patient. So they were a little bit, kind of more standoffish and easier to kind of come into the, okay, this is not my patient. So I'm really respectful of what y'all were doing. And those were the best births, because they just didn't know either. And I'm like, okay, well, what are we doing today, Tracy? I'm like, okay, are you comfortable with A, B, and C? Well, I don't really know how to do that. So let's do this. And there's some compromising in that. A doctor might not like a birth stool, but they don't mind mom being out of the bed, like next to the bed. Maybe they're on the floor, but they don't really know how to do certain things. So it's all about perspective and respecting everybody on the team. Even those of us who are not looked at as professionals anymore. And it still blows my mind.
It's so wild.
It still blows my mind. So I saw on your stories, like, I don't know, it's been a little while, and you'll give me the time frame, but you lost a really close friend. And did you work with her at the hospital? No,
we were so different in so many ways. So in a couple of days, it'll be 4 months. I've known her for about 15 years, and she's not medical. She was a photographer and a musician, and she's artistic and a runner. And like, she knew me before my husband knew me. And then she's a huge family like me. And, so her name is Amy. And so Amy, and she has a sister named Abby, and the three of us were just like, we were just like a little triad, a bonded little group. And eventually, like in adulthood, you all splinter off, and we all lived in like completely different places. And so when we started having babies, we started sending like audio messages and like voice memos to each other, like all day, like every day almost. And hours and hours, we just talked. And like, she became one of the best friends I've ever had in my entire life. So yeah, but she was like nothing to do with medical, neither of the sisters, right? So Abby and Amy have nothing to do with medical. And like, also like Amy and Abby they're probably like more holistic, very like, I don't know about vaccines. I don't know about this. You know what I mean? So, she always had like, she had skin stuff going on and Lyme's disease and flare ups. And she would, go do functional medicine and do all like super different things, her diet. But it was fun. It was just, we were so different and it was so fun. And we were so alike in other ways that really mattered, like the core of who we were. Talked about parenting stuff. Like it felt like we were raising our babies together. So yeah, she like literally was just like a beautiful friend I found in my life. I didn't meet her through work or anything. So yeah, that's Amy.
And so what happened? So was she sick? This was kind of sudden, wasn't it?
It was super sudden. I mean, the shock of it was, I mean, that's like a good chunk of how horrific this has been. Is it's not like she got in a car accident. It's not like she had cancer and we foresaw this. It truly was like one day we were talking and a week later she was gone. And so what had happened was, and I can't get into too many specifics because of like her husband and her daughter and stuff there's still stuff they're teasing out. But she, like at the end of July, she started getting sick. Her daughter had been sick. Her daughter's 5. And her daughter got well and was over it. And Amy was not getting better. And it just like got progressively worse. And she got a really high fever. She went into the local emergency room and I don't even know. It's tricky because like me doing medicine for so long, I look back and I'm like, I feel like there were a lot of balls dropped there. So that's another thing that was frustrating. And she's a woman. So I felt like she wasn't taken very seriously. She was there for 13 hours and just was in a wheelchair the whole time. They were like fluids and that was it. And then she went home and just a handful of hours later, she was admitted to my hospital and she was on a ventilator and ECMO and all the things. And she was gone the next day. But yeah, like when they dropped her off at my hospital at the front, her husband went to park the car and she walked in. Well, they wheeled her in a wheelchair. And by the time he came to the front after parking the car, they just like ran him to the back and they were already doing all the things. And this was just hours apart of her being in the first emergency room. So, yeah, she ended up having just a strep throat and she had become septic. She coded that night in my hospital. They had done surgery to see, they didn't know if she had like necrotizing fasciitis or what was going on. She did not, but she was gone the next morning. So meanwhile, like on my end of it, I hadn't heard from her in a couple of days, but like, that's not super weird, but it is weird because eventually we would have been like, hey, I'm sick, and we'd complain about being sick. So I hadn't heard from her for a few days and I didn't even know she had a cold or anything. And so then one afternoon, I got a message from Abby, her sister and my friend, just saying like, hey, Amy's really sick. She's gonna be going to your hospital and like, she's in the ICU. And I was like, what? And then hours later that night, I got a message being like, she's septic. She's got this, she's got that, she's got this. Da, 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 da. And, I just was like, this is like really bad. And so I went to bed that night. I remember thinking like, okay, on paper, like she probably isn't going to make it, but I didn't like believe it. And so then the next morning I got a message from her sister about 30 minutes after she died and said she was gone. And it was like the most like undignified reaction of my life. Like I was absolutely frantic. Like I just ran to my husband and was like, she's gone. Like I was a mess. And the following day I was supposed to fly out to Canada for another good friend's wedding. And like, so then immediately I was like, do I go to Canada? What do I do? What is going on? Like, and I just like the whole day that I found out she died was sort of like a fog of, I remember like, I was so shocked and so sad. Like I felt like my chest hurt. Like it felt like there was like a weight on my chest. I could hardly take deep breaths because it was like nothing I've ever experienced in my life. And I've had hard stuff. Like I've had lots of pregnancy losses. This was like, it knocked me flat on my back. It was shocking. It was traumatic. It was awful. She has a 5-year-old little girl. Yeah. Like it's, yeah. And then it's just me and her sister talking every day. And just the muscle, like I want to text her. I want to message her. I want to call her. I want to visit her. I want to see her. Like, and it's been like just a constant series of like she's not here. She's not here. You keep thinking she's on a trip, but she's not back. So yeah, it's been.
And grief is just the weirdest emotion.
Yeah.
It's the weirdest thing.
Yeah.
Ever. Because I feel like our brains are like, it's not okay, but it's okay. And it's like fighting to.
Oh. Yeah. Yeah. It's the thing that like, what's also in my minds a lot is because Abby and she's been my best friend for, these 15 years. And then the three of us became really close when we started having children. And so this has been so awful losing Amy. And then the same time, I live in this like kind of not a fear, but this like, if something happens to Abby, like I'm screwed. Cause like, the one thing that's getting you through is because I have my other good friends, right? I found like I have a handful of like these women I've found in my life that have become like sisters. Cause I'm like extroverted, but like, well, I mean like super social, but I don't just pour my life out to everybody and let them in my bubble. Like they might think we're a lot closer than we actually are. But like, so when I find somebody that I'm like, oh, this is a good person. Yeah. Then I have a collection of just a very few little girls in my life and they know me like only my husband would know me. So the thing is when Amy died, like the other girls don't know her. They are sad for me. And it's a tragedy. But with Abby, it's like, we know that Amy used to burp really loud and it was super embarrassing and crazy. And like, we knew she loved food. We knew she did this. So like, when we just had Thanksgiving, we can talk to each other and be like, Amy always brought the sweet potato casserole. And it like, so with Abby, it's been nice to have like somebody anchoring you just for each other. And there's this other thing going on where you're always worrying that like, if I talk to my other friends about it, are they sick of hearing it yet? Like, you feel like there's this window of where people they're like, okay, we feel bad for you now. And you talk about it all you want. And then you have like a week or two. And then they're like, can you just like, are you done with that yet? Like, so no one has said that, but like, you kind of feel like, are they sick of the Amy thing yet? So when you have my friend Abby, and who's her sister, it's like, we're never sick of it. We can always talk about it. We can always talk about her. We can always talk about how sucky this was or how shitty that was. But then at the same time, you're just like, if something happened to Abby, I am screwed. Like
we're gonna put her in a bubble. Yeah.
Just to stay in a bubble.
In a bubble.
Yeah.
So how has work been for you since that's where?
Yeah, she died just a few floors below where I work. The first day back, because I went back not long after, it was like my worst day back at work that I've ever had. I've had miscarriages while I've been working, taking care of pregnant women. You know, it's sad and cruddy, but like this was so bad. It was, it's hard because like I've said that way, way back when, like, they used to wear like black to kind of signal to everybody, like I'm going through shit. So like hand me kid gloves. Like we don't do that.
The veil. Yeah. The veil.
I feel like, just
don't talk to me. Yeah.
Race. Yeah. Nobody does that. So like, I just come right back and I go on the elevator and I pass the floor where I know she died and people get on and off the elevator from that floor. And you're like, I just was wondering, like, were they there that day? Was that her nurse? I know everybody talked about it because she was 36 and she showed up talking and was dead the next day. So I know that rocked everybody, right? So like, did they know her? Did they know Amy? And then you get on your floor and like the minute I'm in my room with my patients, it felt super normal and natural. And like, I'm like super nurse Sarah is there and like nothing changes that. And then I shut the door as I leave and I get at the nurse station and I want nothing to do with anybody. I like any stupid little thing that I don't know, some stupid little thing that I think is insignificant and meaningless and a box checky that doesn't actually help anybody. I had no tolerance for it. And I felt like tears were just waiting to come out all day long. And that does not mean like I'm a very bubbly, personable, like want to help people out, chat, be nice. So like I normally can like fake it. I couldn't even just like slap on the face for 12 hours. Like I could not. And somebody I know came up to me and she knew that Amy had died because she knows my husband and stuff. And the minute she was like, I'm sorry about Amy, I was like, "Ah!" And I just was like,
Yeah.
I was done. It was awful. It's fine now. Like the more you just go and you do it again and again and again, it's work again. It's not where she died. But it definitely was at first. And yeah, it just like,
grief is strange physically and emotionally. Yeah. Because our bodies are going to, if you haven't done it up here, your bodies are going to end up doing it.
Yeah.
You know?
Oh,
right. Yeah. I mean, it's pretty fresh for you. Like, this is not old at all. And, you know, having to give ourselves grace, but having to work too. Right. And the resilience and the reason, like, I admire, and it doesn't feel like that when you're going through it, but I really admire how you still get up and go to work, and you still are like sharing this stuff on your friend group on Instagram stories, and you know, and it's cliche to say pushing through, because that's what you're feeling. You feel, you know, swimming through sand is what I say a lot when we talk about grief, and being, you know, and then feeling guilty about, you know, grieving when everything is okay. And that sounds very weird to say, because things are not okay. You miss your friends.
Yeah.
You know,
it's like, that's as simple as it is. Yeah. It's just like her sister and I have said, it's like, she literally is a pile of ash. Like, she's a pile of ash. And it's like,
and somebody had to go get her from the funeral home. She had to bum a ride off of one of y'all. You know? And
it's just like, what do you do with that? I'm like, even,
it's a super surreal feeling.
Beautiful. She crystal blue eyes, like beautiful and athletic, and like took great care of herself. And like, even her whole body is it's dust. And it's even that you're like, what? And her daughter, like, her daughter lose tooth. She's not seeing that. Her, you know, got her ears pierced. She's not there. I read her daughter a bedtime story a couple weeks ago. Like, why me? Why is her mom's friend doing that? You know, like,
you can be angry. You know, we can have all kind of emotions at the same time, and people don't like that because it hurts so badly. And it's like, I think the healing process is to allow all the emotions at one time. You know, we don't understand why things happen, but they do. And they happen to really good people, which, you know, is very hard to accept sometimes. But you are in her daughter's life for that reason. She's going to grow up knowing her mom, because.
So we've been saying a lot too. It's just like 5 it's old enough for her to remember, but it's also still so young. And you're like, she's got to know how awesome this woman was, and how intentional she was in her parenting, and how much she processed her behavior with us. Like, did I make the right choice? Did I approach her the right way when I did this? Like, I mean, we were always having these talks of like, you know, my daughter said this, or she did this, and like, this is how I responded. And I apologize because I overreacted, and my parents, this is breaking a cycle. This was something I didn't do. And I was like, she was like, she cared so much. And yeah, her sister and I have just been like, we have to make sure her daughter knows that she's got to know about her. And
I love seeing the healing process of y'all going through her stuff, and you, like, you know, wearing some of her clothes.
Yeah.
And I was like,
that,
because we don't talk about, we don't talk a lot about, you know, like the respectful part that people think that they're supposed to do. Like, what am I supposed to do with? I'm just going to pack all their stuff up, you know? And, you know, some people they trash a lot of things. They don't even give it to like Goodwill or those kind of things. And I was like, that is the way to honor somebody.
That was another, I'm like, I feel like I could do an episode just on that, because it took us 2 days that we split up over a couple of weeks, because, like, her husband said he wanted, like, her daughter still gets into her things and plays with her things. And like, oh my gosh, like, she'll wrap herself up in her clothes and snuggle them. And so he was like at a point where he's like, you know, I've got to thin out, but like, I want, like, he wanted to wean, like, wanted to kind of wean it. so that it wasn't so stark and everything's just gone one day. And so it was like a 2-day thing, a few weeks apart. And she still has stuff up there that her daughter can play with. But that I've never gone through anything like that in my life. No, none of us have. It was like her sisters, one of her good friends and me. And it was the first day I said, oh, it was so hard. It was just so hard. We went into her house and everything's just frozen in place. Like the shoes before she went to the hospital, the bed she had been sleeping in the guest room because she was sick. So she didn't stay in the room with her husband. She's a violinist and her music was there on the stand where she'd been playing. And you just have to like go through it and get a system. And it was so hard and we were crying so much. But then I walked away and I was like, it's insane because I have sisters and I've spent thousands of hours at my sister's house. And like, I don't know how she organizes her feminine hygiene products. I don't know where her socks are. It was stuff like that because you have to go through everything. You're going through like her deodorant and her like literally everything. And, you know, what do we donate? What do we keep for ourselves? What do we keep for her daughter? What would her husband want? I remember thinking like it was so intimate. Like she saved tissue paper and she'd fold it neatly and stack it a certain way. She saved ribbons and had them organized. She saved boxes and gift bags and like all of that. And I'm like, you wouldn't know that if you weren't like in the depths of her home learning this about her. And so I remember just thinking like, even after she was gone, I was still like learning things about her and getting to know her. And that's not something, only my husband would know that about me. My friends don't know how I organize my tissue paper or something. Like I like it was super personal. And even that, like there was one hand where you're like, that was cool, but it also felt like so like this shouldn't need to be happening. The second day you kind of like adapt and you're like, all right, we're going through Amy's things and you have your system. And we got through it really fast and we did okay. And there weren't as many tears, but then it was like the finality of it, like her whole life in 2 days, and that was that, like, and that second time we went through it a few weeks later hit us like, it was like, we were in a funk for days after that. Like we went out that after we loaded up the car to donate the stuff and kept the stuff we wanted and saved the stuff for her daughter. We went out to a winery and talked about her and for hours. And I was in a funk for like 2 days and it was super, super heavy. And I was just crying and crying and crying and crying. And I feel like that's kind of how it's been. Like Abby and I talk about it a lot. It's like, there's some days where you're just kind of like, you're living life and you're doing your thing and it's normal. Yeah. And then there's other days where it's just like, what just happens? Like, how is this real? And it's like sitting below the surface and you're crying all day. And I don't like the term, like it comes in waves. Cause I don't feel like that's a good, like, I feel like it's a swinging pendulum. It's like the pendulum of like, I'm okay. Like I'm doing life. We're doing a thing. I'm busy. And then this one, we're like, I'm a wreck. Sorry.
What do you feel like, or have you, had some enlightenment like about yourself through this grieving process that you were surprised about?
Yeah. I don't even know I don't know. I think, some things are like, one, I'm acutely aware of how valuable these people are in my life. Like literally the day she was gone, everything in my life changed. And I had no idea how much she was ingrained into my day-to-day life. That would have been the day I'd have messaged her and been like, I haven't heard from you in a while. Like, what's up? How's life? Because it had been a few days. Then, now in one way, everything feels very, very fragile. I don't feel like anything is permanent or guaranteed. And then in another way, there's an appreciation, like it's a privilege to grow old. It's a privilege. You're fortunate to get old and get wrinkles and have gray hairs that I'm getting and to be closing in on 40 because she never will. Like it's a privilege that I'm seeing my kids lose their teeth and get their ears pierced. And like my daughter already knows me a year longer than her daughter will. So there's that. And then there's also like, there's more intentionality behind the things I do. I'm also like, if I die, people have to go through my things. Is there anything here worth keeping?
Do they know my passwords? Do they know my?
She had tissues. Oh my gosh. She had rolled up tissues in all the sleeves and all the pockets, everything with tissues everywhere. In her hats, there were tissues. There were tissues everywhere. So I was just like, it's stuff like that. I am like, I need to write a will. She didn't have a will. So I'm just like, okay, we need to write a will. So like
I think that will thing is like, I feel like we don't like to talk about that final, especially if we're like below 60, because I'm 52 and I don't have one. And
why would you?
yeah. And it's kind of like, oh, well, that's a thing that needs to happen. And I probably should have done it when the kids were small, because I mean, that's just something we don't think about, but I think it's even more important, because what if, for some tragic reason, you and your husband
both at 36,
right. Yeah.
So yeah, I mean, so I've been thinking about like what we're going to put in our will. And then it also like big things like what matters to me? What do I want to make sure whoever were to take my kids, what do I want them to be doing with the kids? Yeah. There's a lot of like, especially with her sister, a lot of like, where is she? What has happened now that she's gone? Is she like, is heaven real? Is she in heaven? What is she doing? Like, I've had for weeks, I had so many dreams about Amy. And I mean, every night I dreamed about Amy. I dreamed about her audios. I dreamed about texting her. I dreamed about seeing her again and again. And then her sister had nothing. She had no dreams, nothing. And so she'd be like, I wish I was dreaming about her. And I was thinking like, I wish I would stop dreaming about her. And every day I wake up, I'm just like, she's gone. She's gone. Like I'm in a nightmare. And one of the last, sorry, I'm like emotional.
No, yeah.
Like,
yeah, it's okay.
One of my last dreams was it was like so cheesy, like stereotypical, but like she and her daughter were holding hands in a meadow, and then she just let go and walked away. And we were like calling after her, and we were like, come back. And she just walked away into these woods. And I think it was like my brain trying to be like, she's really gone. Because it's like when I went to sleep, my brain was just like, she's on a trip. And so I think maybe like subconsciously, I was just trying to even get like my subconscious to like really understand this is the reality now. Like she's really gone. Because like I said, like I had no idea. Like, it'd be huge if you lost one of your best friends, but like every tiny little thing, like my daughter had a birthday right before she died. And I find myself like, oh, I was sending birthday pictures to her. And I'm like, no, I can't send her that message. Like, she's not going to see it. It's going to her husband. So and you just keep thinking she's away and she's going to come back. And so I think my brain just needed to be like, she's gone. And her sister was like, maybe she's trying to tell you something. And I'm like more of a realist where I'm like, girl, if she could pass the abyss and into communicate with us, she's not going to be reaching out to me. She's going to be reaching out to her kid or her sister. I wouldn't be reaching out to any of you bitches. I'd be reaching out to my kids. I'd be like, first I'm going to talk to my kids and my husband, and then we're going to go to the friends. And so if I'm having dreams before her daughter, it's probably my brain. It's probably not her. So yeah, she'll come to me later. I'm like number 3 on the list. But yeah, so yeah, it's just.
But you were important to her, so you might be in first in line. Well, and I'm religious and I do believe in Christ and all of those things, and dreams are a big thing, are a big deal, and I do believe that there is a spiritual realm that we don't see. And I think that if we are susceptible to the inviting of what the self-conscious can give us, you just might be more open right now than anybody else. And, your grieving process is going to be different than husband and sister. And, and kids don't like they might be dreaming and not even know, because if she's 5, she's in a reality and fantasy anyway, right? In her 5-year-old little head. And so accept that might be, something. And she's saying, hey, I'm good. Don't hurt, don't say goodbye to me, but don't hurt as much as you are hurting. And I'm sure she's like, hey, it was sudden and I'm really sorry that we couldn't party my way out of here. But don't diminish the fact that you were important to her and you were definitely in line. Yeah.
It is weird because like other things that come up with grief is like, it will have me like gaslighting myself. Like maybe I wasn't as close to her as I thought. Like it's so, cause like when we was going through her stuff, I remember being like, should I be here? Like it's her sisters and me. And I would want her there if it had been reversed. I'd want like my sisters. I'd want her, Abby, some of the girls from TikTok, honestly, I'd probably want them to come and have a pass at my things.
Yeah.
It is really weird what your brain does and how it is just like, maybe you weren't, she was super, super extroverted and super social. And like, she loved people. And I just was like, I could be one of a dozen people she talked to like this every day. So like, you were like, gaslight yourself. And I know it's grief, maybe I was trying to make it seem like, I don't know, make it hurt less. But no, it was a big one. It was the hardest loss I've ever had in my life.
Yeah.
And it's,
well, I've watched your resilience through it, and I admire that because I know, because I've lost people that were close to me, and it's very, it's just hard, and it's a struggle. And of course we put out on social media what we want people to see, and we hide everything else. But, you know, publicly, I just want to say I see both. And, you know, but your strength very much comes through. And I appreciate that. I know her family appreciates that. I think you're a fantastic labor and delivery nurse and a person on top of that. And I'm thankful that you said, hey, I'll sit down with you today and talk on your podcast. I just really appreciate it.
I'm so glad you asked. I've not been able to talk about her really. Like to the people in my life, I've been able to, but I've not talked about her like this, at all and publicly, or I've talked a bit on my platform, but it was really nice just that you cared, that you wanted to know. It means a lot. Thank you so much for inviting me.
Yeah. I mean, we're people, and we're people behind the social media names that we have. And I appreciate you. We might need to do part 2. We'll give you a little time, and then we'll come back and we'll probably do part 2.
I'm down. I love talking about her. I love talking about how sucky it is without her. I love talking about how cool she was. And anytime anyone wants to talk about her, I'm down. So.
And put me in your group. I'll take pictures. Yeah. I'd love to know.
Come be in the videos, please.
Yeah. We need to schedule a trip because you're right. It is a cherished treasure to have, especially women that are adults. It is really hard for us to make those bonding relationships that last for a lifetime. And that sounds cheesy, but it is real. It is real.
That's one thing that is like, it's made it so crystal clear that everything about my life is 200% different when I have amazing women in it. Losing her made that so clear. So I'm so grateful for the women I have in my life.
Oh, well, thank you again. And we will talk at you soon.
All right. Thank you.
Thank you for listening to the Keeping Your Power podcast. I hope this episode reminded you that your feelings are valid and your voice matters. If it spoke to you, share it with someone who needs to know that they are seen. You can connect with me at tracidoula.com or anywhere on social media at Tracidoula. On our next episode, we're going to sit down with Frances, also known on social media as She's Having a Baby, where she's devoted her platform to educating and advocating for birth equality due to Black women dying 3 times the rate of white women. I'm looking forward to you joining us while we dive into this important topic and how we can support her resilience on this heavy journey. Until next time, keep your power in the process.